120/80. That is what your doctor told you. That is what every health guide says. That is what millions of people believe. And for half of them, that number is a lie. Not because medicine is wrong, but because they are measuring a false value every single day with their own hands. And based on that false value, decisions are being made. Pills swallowed that are not needed, or warnings ignored that should have been treated long ago. Up to 30% of all high blood pressure diagnoses worldwide are incorrect. Percent. That is millions of people. They take a pill every morning, place it on their tongue, swallow it with water, and that pill they do not need. They are not measuring their blood pressure. They are measuring their mistakes. Today, I am going to go through 10 of these mistakes. Mistake number 7 will surprise you the most, because even experienced doctors make it in their practice. And mistake number 10 shows why your blood pressure rises during measurement because of the measurement itself. My name is Dr. James Carter. I have been practicing medicine for over 30 years, and on this channel I talk about everything that affects health after 61st, the scale of the problem. In the United States, nearly half of all adults over 60 have high blood pressure. Most of them measure regularly at home, and most of them measure incorrectly. Two groups emerge. The first group measures too high because of errors in technique, gets a false result, and takes pills that lower an already normal blood pressure. Dizziness, weakness, fatigue. The person thinks, I am just getting old. But they are simply being treated for something they do not have. The second group measures too low, sees reassuring numbers, feels calm, and lives with a time bomb in their vessels without knowing it. A blood pressure monitor is a brilliant device, but like a Stradivarius in the hands of someone who cannot hold the bow, it produces a sound, but not music. You get numbers, but not the truth. Let us begin. Mistake number 1. You come back from a walk, just had a cup of coffee, or got briefly annoyed at something, and you measure immediately. The number on the display frightens you. You measure again, even higher, panic. And everything would have been different if you had waited 10 minutes. What happens in the body when you exercise, drink coffee, or are under stress? The adrenal glands release adrenaline and cortisol. These hormones constrict the small vessels throughout the body immediately. The heart pumps harder. The resistance in the arteries rises. The device measures exactly that, a temporary spike. Not a disease, a reaction. In 20 minutes, it is gone on its own. Concrete numbers. 1 cigarette 30 minutes before measurement, plus 10 to 20 points on the upper number. A cup of coffee, plus 5 to 15. Strong black tea, similar. A full meal, plus 12. An emotional phone conversation leaves traces in the vessels for 15 to 20 minutes afterward. And now something almost nobody knows. Eye drops for redness, available over the counter at any pharmacy, often contain vasoconstrictive compounds. You use the drops in the morning, measure an hour later, and get plus 8 to 10 points from nowhere. The same applies to nasal sprays for congestion. You treat the lining in the nose, but the effect is systemic. The whole body responds. Rule number 1. 30 minutes before measurement, no coffee, no tea, no meal, no smoking. 5 minutes before measurement, sit quietly. Back against the chair back, feet flat on the floor. Do not look at your phone. Do not read. Simply sit. Let the vessels return to their resting state. Only then apply the cuff. According to the European Society of Cardiology, 85% of people who control their blood pressure at home do not follow exactly these rules. 85 out of 100. Because anxiety cannot wait. But exactly these 10 minutes of stillness stand between panic and the real truth about your heart. Mistake number 2. You are sitting correctly, waited the necessary time, everything seems by the book. But one single detail destroys the entire measurement, your body position. Your body is a hydraulic system. Picture a network of pipes through which fluid flows under pressure. Every bend, every angle, every change in height alters the pressure in those pipes. That is exactly how your circulation works. Crossed legs. You do this automatically. Sit down, cross the right leg over the left. Habit. A study from Erasmus University Rotterdam showed crossed legs during measurement raise the upper number by 7 to 8 points, the lower by 3 to 4. And that is not a brief spike. It is a stable change that persists as long as the legs are crossed. Why? You compress the large veins in the thigh area. Blood from the lower body returns more slowly to the heart. The heart responds immediately, pumps harder to compensate for the restricted return flow. The monitor registers it. Back without support. When you sit on a stool, on the edge of the bed, on a chair without leaning back, the core muscles contract to keep you upright. That is isometric muscle work. The body is working even though you feel like you are resting. Result, another plus 5 to 10 points. Arm height. Here pure physics begins. The cuff must be exactly at heart level, not approximately, exactly. If the arm hangs at the side, it is lower than the heart. Gravity adds a column of blood. The value is too high. Every 10 centimeter deviation downward equals 8 points added to the display. Rule number 2. Back fully against the chair back. Both feet parallel on the floor. No crossed legs. The arm with the cuff resting on a table so that the middle of the upper arm is at the level of the breastbone. If the table is too low, put a book under it. This is not a luxury. This is the difference between truth and illusion. Mistake number 3. You bought the device, opened the box, and simply used the cuff that came with it. Since then you have been measuring daily, and since then the cuff has been wrong. Imagine you want to measure the circumference of a tree. You have a rope. If the tree is thick but the rope is too short, it digs into the bark. The measured value is smaller than the real one. If the rope is too long, it hangs loose. The value is too large. Only a rope that fits exactly delivers the truth. With the blood pressure cuff, it is exactly the same. Almost all devices sold at American pharmacies come with a standard cuff, designed for an upper arm circumference of 9 to 13 inches. Look at your arm. If you have a larger build, completely normal after 60, your upper arm circumference might be 14, 15, or 16 inches. The standard cuff digs into the tissue before the device has even begun to measure. Result, 10 to 20 points too high, in some cases 30. The British Hypertension Society analyzed up to 25% of all incorrect home measurements result from an ill-fitting cuff. 1 in 4 wrong readings because of a piece of fabric with a rubber cushion inside that simply does not fit the arm size. How do you measure the right size? Take a measuring tape. Measure the circumference of the middle of your upper arm between the elbow and shoulder joint. If the value is over 13 inches, you need a large or extra large cuff. Under 9 inches, small size. Cuffs are sold separately at any pharmacy. And the second part of this mistake that even more people make, measuring through clothing. The difference is 5 to 15 points. The fabric between cuff and skin disrupts the transmission of the pulse wave. And if the sleeve is rolled up and cutting into the arm from above, a tourniquet effect is created. Blood flow in the arm is restricted. The display jumps unpredictably. Rule number 3. Measure your upper arm circumference before buying and choose the right cuff size. Apply the cuff only on bare skin. The lower edge sits 1 inch above the elbow crease. The tube runs downward along the inside of the forearm. Mistake number 4. You waited, sat correctly, applied the right cuff. The device shows 147. You write it down. Done. Have you ever wondered why the device shows a different number the second time than the first, even though you have not moved? Not because the device is defective, because a single measurement is statistically meaningless. Imagine you want to determine the average temperature of your city. You go outside once, on a Tuesday at noon, note 82 degrees, and declare that the annual average. Sounds absurd, but that is exactly what most people do with their blood pressure. Your pressure fluctuates every minute. It responds to a sip of water, to a thought, to the memory of an unpaid bill. A single measurement is a snapshot of one moment. It says nothing about the rest of the day. What do international protocols say? 3 measurements with 1 minute between each. The first measurement, throw it away. Do not record it, do not analyze it, do not panic about it. It is almost always elevated, because applying the cuff, the weighting, the slight tension, all of this affects the first measurement. Take the average of the second and third. That is your real result. Less than 12% of people in the United States who control their blood pressure at home take more than 1 measurement per session. The remaining 88 believe the first value like gospel. Based on that one number, medication doses are increased, a second drug is added, or the warning is ignored. Rule number 4. 3 measurements, 1 minute pause between each. Throw away the first, average of the second and third into your log. Mistake number 5. You are sitting correctly. The cuff is in place, the device is running, and then someone in the room asks, "Did you take your pill this morning?" Perfectly normal conversation, nothing dramatic, but the result on the display is now useless. Speaking is muscle work. When you talk, the muscles of the diaphragm, intercostal muscles, larynx, tongue, lips all contract. The breathing rhythm changes. In an emotional conversation, the nervous system joins in. All of this together creates a wave of muscular tension that raises the value by 10 to 17 points. Not 2 or 3, 10 to 17. A research group at the University of Milan demonstrated this in an experiment. One group was silent during measurement, the other answered simple questions. The difference was consistent and substantial. And now the surprising part, even counting out loud 1, 2, 3, 4, produced a stable increase of 6 points. The mere act of speaking, the vibration of the vocal cords, the minimal tension, that is enough. This is why I say these mistakes are even made by medical staff in doctors' offices, not out of negligence, out of human nature. The nurse speaks with the patient, reassures them, builds rapport. Every word during measurement steals accuracy. Rule number 5. During measurement, absolute silence. Do not speak. Do not listen to anything that requires an emotional response. Do not nod. Do not gesture. Remember one phrase for the doctor's office. May I please stay silent during the measurement? No physician will refuse you that. And that one phrase can make the difference between a correct and an incorrect result. Mistake number 6. Morning, you wake up. First thought, measure blood pressure. You get up, go to the kitchen, sit down, apply the cuff. Everything correct. But you forgot one step that costs 13 to 22 points. Going to the bathroom. A full bladder raises blood pressure. Measurably, reproducibly, substantially. The mechanism is two-stage. Stage 1, mechanical. The filled bladder enlarges and presses on surrounding structures. Directly above it runs the abdominal aorta, the main artery carrying blood from the heart to the lower body. A fully distended bladder mechanically presses on these vessels. Blood flow is restricted. Peripheral resistance rises. Stage 2, nervous. In the bladder wall, there are stretch receptors. When the bladder is full, they send an alarm signal to the sympathetic nervous system, the same one responsible for the fight or flight response. Noradrenaline is released. Peripheral vessels constrict. The heart beats faster. In men over 60 with an enlarged prostate, which already creates pressure in the pelvic area, the increase can reach 22 points. 22 points, because nobody went to the bathroom before measuring. Rule number 6. Empty the bladder before every measurement. Every time, even if there is no strong urge, bathroom, then chair, then cuff. Mistake number 7. And this mistake will surprise you, because many people make it for years without noticing it, and because in certain cases it is a warning signal that can save lives. Most people have been measuring on the same arm for years. Left, because it said so in an old book. Or right, because the device sits on that side of the nightstand, without ever thinking about whether that makes sense. A difference of up to 5 points between the right and left arm is physiological norm, but when the difference is consistently more than 10 points on the upper number, that is not an anatomical characteristic. That is a diagnostic marker. Why? The blood flowing from the heart to the right arm passes through the brachiocephalic trunk and the right subclavian artery. To the left arm, it flows directly through the left subclavian artery, which branches directly off the aortic arch. Those are different paths through different sections of the vascular tree. If there is an obstruction on one of those paths, an atherosclerotic plaque, a narrowing of the vessel wall, then the pressure on that arm is lower. And now the counterintuitive part. The arm with the lower value is not the healthier one. It is the sicker one. Its pressure is not low because the vessels are fine, but because there is an obstruction in that vessel dampening the pressure. A large study at the University of Exeter analyzed data from more than 28,000 patients. A stable difference of 15 or more points between the arms raises stroke risk by 60%. The risk of a cardiovascular event by 70%. Rule number 7. Once per month, control measurement on both arms. Measure left, record. Wait 2 minutes. Measure right, record, compare. Difference up to 7 points. Everything normal. Keep measuring on the arm with the higher value, not the lower one. Difference over 20. See your cardiologist. And all daily measurements always on the arm with the higher value, not the more comfortable one, the higher one. Mistake number 8. You measure once in the evening when you turn off the TV before bed, or in the morning right after waking. And from that one-time point you draw conclusions about your blood pressure. Your pressure at 6 in the morning and your pressure at 10 in the evening, those are the values of 2 different organisms, not metaphorically, physiologically. Between the nighttime minimum and the morning peak, the difference can be 20 to 30 points. That is normal. That is how nature designed it. Around 4 in the morning, while you are still sleeping, the adrenal glands begin releasing cortisol, the wake-up hormone. By 6 to 7 in the morning, the pressure has risen. By 9 to 10, it reaches the first daily peak. This is called the morning surge, and it is absolutely physiological. But exactly in this window between 6 and 10 in the morning, most heart attacks and strokes occur. Not at noon, not in the evening, in the morning. When the vessels are not yet warmed up, the blood is more viscous after the night's rest, and the pressure suddenly rises. Like a cold engine being driven at full throttle immediately. Those who only measure in the evening completely miss this most dangerous moment. The evening value is relaxed and low, and gives a false picture of safety. The European and American cardiology societies have been recommending twice daily monitoring for years, morning and evening. Morning measurement within 1 hour after waking, before taking medications, before breakfast, after going to the bathroom. Evening measurement, half an hour to 1 hour before sleep in a resting state. Rule number 8, measure twice daily, in the morning window and the evening window. Record both values with the exact time. After 1 week, you do not have a collection of random numbers. You have a map of your vascular rhythm. Mistake number 9, you stand in the pharmacy. On the left, a classic device with an upper arm cuff, bulky with a tube. On the right, an elegant wrist device, small, light, looks like a watch. The choice seems obvious. You take the wrist device. 9 out of 10 buyers do the same, and 9 out of 10 make a mistake. At the wrist, there are 2 arteries, the radial artery and the ulnar artery. They are significantly thinner and more superficial than the upper arm artery that the classic device measures. The pulse wave here is weaker, the signal less stable. Any minimal movement of the hand, any rotation of the wrist, and the sensor loses the rhythm. Then there is the physics of height. The cuff must sit exactly at heart level. With the upper arm device, you rest the arm on a table and the cuff automatically comes close to the right height. With the wrist device, you must lift the joint and hold it exactly at the level of the breastbone. Exactly, not approximately. Exactly. Lower the wrist 2 inches plus 4 points. Raise it above heart level, -4. And try to keep the wrist still at one height while the cuff inflates and the arm falls asleep. That is practically impossible. The result: the scatter of readings from wrist devices in normal home conditions can be 25 to 30 points from one measurement to the next. With the same person, in the same minute, simply because the wrist is positioned slightly differently each time. You think your blood pressure is jumping. In reality, your wrist is jumping. Rule number 9. Buy a device with an upper arm cuff. At home, exclusively the upper arm device. Look for devices validated by the American Medical Association or British Hypertension Society. These have been tested for accuracy and carry a corresponding seal. Mistake number 10. And this mistake is different from all the others. It has nothing to do with the device, nothing to do with body position, nothing to do with the time of day. It plays out in your mind. You measure. The display shows 147. Something in you tightens. Your heartbeat accelerates. You think, that is high, that is dangerous. What is wrong with me? You wait a minute, measure again. 153, even higher. Panic grows. Third measurement, 159. You are convinced, crisis, catastrophe. What really happened? The first result was perhaps a random spike, but when you saw the high number, you were frightened. The fear triggered an adrenaline release. The vessels constricted. The heart beat faster. The second measurement did not register your resting value. It registered the value of a person in acute anxiety. The third, the value of a person in panic. This is called the emotional measurement spiral. Each next high number amplifies the anxiety. Each spiral of anxiety raises the value further. The monitor stops being a diagnostic instrument. It becomes an anxiety generator. This is closely related to what medicine calls white coat hypertension. In some people, the pressure rises in the doctor's office alone, at the sight of the waiting room, the sterile light, the cold stethoscope on the skin, the authoritative figure in the white coat. Estimates suggest that 15 to 30% of all high blood pressure diagnoses made in American doctors' offices are exactly this phenomenon. And the opposite phenomenon, masked hypertension. The person comes to the doctors, is relaxed, and paradoxically gets normal values. Because for exactly this person, the silence at home with the monitor on the table means more stress than the doctor's visit. Rule number 10. And it is perhaps the most difficult of all. If you see a high value, do not measure again immediately. Stand up, leave the room, drink a glass of water. Take 10 slow breaths, 4 seconds in, 6 seconds out. Give yourself 15 minutes, and only then measure again. Not in a state of panic, in the stillness that you have allowed to enter. 10 mistakes, all behind us. Now to the question with which this video began. Why is 120/80 a lie for many of you? In 1905, the Russian military surgeon Nikolai Korotkov first described the method for blood pressure measurement with stethoscope and mercury manometer. At the time, thousands of healthy people were measured and the average was determined. It was close to 120/80. That number was declared the norm. And since then, this number has taken on a life of its own. In textbooks, in doctors' offices, in the minds of patients, as dogma, as law, as the only right answer. The problem: an average is not a norm. An average is a mathematical abstraction. For one person, 110/70 is their absolute normal. They are energetic and think clearly. For another, 135/85 is normal, without any pathology, without any risk. This is called working pressure, the individual value at which a specific organism functions optimally. It depends on dozens of factors: age, sex, build, genetics, body height. After age 60, the vessel walls lose elasticity. That is not a disease, and that is biology. The aorta becomes stiffer. It dampens the heart's output less effectively, and the upper number gradually rises. In a 70-year-old person, 138/82 can be an absolutely physiological value, at which the brain receives adequate blood, the kidneys filter normally, and the heart is not overloaded. If in such a person the pressure is aggressively lowered to the ideal value, that can have the opposite effect. The brain receives too little blood, dizziness, instability when walking, memory gaps. The European cardiology guidelines already distinguish target values by age group. For patients over 65, many protocols allow an upper value up to 140, in certain cases up to 150, not as a deviation, as a permissible corridor. What does this mean for you concretely in daily life? First, do not only ask your doctor whether your blood pressure is normal, ask, at what value do I feel well? That is a different question, and a more important one. Second, when your doctor advises increasing the medication because the blood pressure is too high, ask on what basis. A single office measurement, or a 2-week log with twice daily measurements? That is not distrust toward the doctor. That is informed patienthood. No doctor can assess your actual everyday blood pressure from a single office measurement. Only your own careful records over weeks can do that. Third, keep a blood pressure log. An ordinary notebook, a pen, 2 columns, morning and evening. The average of the last 2 measurements, the time, 1 word about how you feel. After 2 to 3 weeks, you see your own patterns. You understand at which numbers you feel well and at which you do not. Those numbers at which you feel good, that is your working pressure, your personal norm, not 120/80. Show this log to your doctor. Not a single number at one visit, but a picture over 3 weeks. That gives them 100 times more information than a single measurement in the examining room. When to see a doctor immediately. If blood pressure is repeatedly over 180, regardless of time of day. If the difference between both arms is consistently over 20 points. If the morning value is regularly over 160 despite correct measurement. If blood pressure drops when standing up, meaning when you stand up quickly it goes dark before your eyes or you feel dizzy. That can be a sign of overdosed blood pressure medication and must be discussed immediately. And if you take blood pressure medication and feel weak, dizzy, or excessively tired, please bring that up. The dose may need to be adjusted. One thing for tonight: measure your blood pressure correctly. 10 minutes of rest, correct posture, empty bladder, 3 measurements, throw away the first, record the average. For the first time, perhaps the real number. My name is Dr. James Carter. I will see you in the next video.